My name is Monica Cortez, and my infectious disease was Rocky Mountain spotted fever. This Rocky Mountain spotted fever is transmitted through a little tick. I found three of them. They are transmitted by the brown dog tick, the American dog tick, and Rocky Mountain wood tick. These little bites will cause this disease. They're mostly common between the months of April and August, and it is a rickettsia. The epidemiology, sorry about that, in statistics, Rocky Mountain spotted fever is common in all of the United States, but it's more predominant in the states of Arkansas, Missouri, North Carolina, Tennessee, and Virginia. Arizona accounts as 50% or more of the total cases reported. It is more common in people in the ages of 40 or more and under 10-year-old kids. It is most common in Arizona. Signs and symptoms of Rocky Mountain spotted fever are fever, of course, headaches, rash, nausea, vomiting, stomach pain, and muscle pain, and lack of appetite. Signs and symptoms of the rash. It may be difficult to diagnose Rocky Mountain fever because this rash likes to appear after 2 to 4 days after the fever develops. And so sometimes the rash won't appear until later on in the illness. And so it is harder for physicians to diagnose. Rocky Mountain spotted fever does not result in persistent infections. If it's not treated, there are some long-term effects. Permanent damage is amputation of arms, legs, fingers, or toes, hearing loss, paralysis, mental disability, and this is all due to damage of vessels in these areas. How do we diagnose and test for Rocky Mountain spotted fever? Well, these tests are done through a blood draw. There are serum tubes that are used. Symptoms are very common to other diseases, and so if you think you might have this, if you've been hiking or been to an area camping where there is a large population of these ticks and you become ill with those prior symptoms, it is important for you to let your provider know so that they're able to run these tests. However, if it takes too long for them to get test results back, they might just start to treat you with an antibiotic before they get the results. Treatment for Rocky Mountain spotted fever is doxycycline. It saves lives, and it's the #1 recommended treatment for these rickettsial infections. It used to be thought that doxycycline would cause tooth decay in the enamel of young children, but it's been proven that it doesn't if it's only used for short-term time. Early treatment with the antibiotic doxycycline can prevent death and severe illnesses. Doxycycline is a recommended antibiotic treatment for RMSF in adults and children of all ages. So how do we prevent this from happening? The best way to prevent Rocky Mountain spotted fever is to make sure that when you go out camping or hiking or do any type of outdoor activity that you are wearing a long sleeve shirt and tucking in your pants and your boots so that these little bugs can't get into contact with your skin. Also, if you have dogs that you take out for your hikes or camping, make sure that when you bring them back that you look through their fur and make sure that they don't have any ticks attached to them. Ticks like to live in grassy, bushy, and wooded areas. So if your animals are spending time outside or your family is out camping, gardening, or hunting, you could possibly become in close contact with these ticks. And so protect yourself and protect your pets. There is a substance called permethrin that you can treat your clothes and your shoes with that acts like a repellent for these bugs. You can also try using an insect repellent that contains DEET, picaridin, and these other different kinds of oils so that the clothes and your scent will keep these bugs from attaching to you. So this is my presentation. I hope you guys enjoyed it and learned something new. Thank you.